let's do this. We're going to sort by percent fully vaccinated. So this is cool. At the very top, there's Puerto Rico by reporting. At the very bottom, there's West Virginia. And what you'll notice is, so really quickly, one of the things that I usually do here is the top and bottom. Percent fully vaccinated. Puerto Rico, Vermont, Rhode Island, Connecticut, Maine. At the very bottom, West Virginia, Idaho, Wyoming, Alabama, and Mississippi. Does that make sense? It does to me. Tests per 100,000 people. So where are people getting the most tests? Top 5. Rhode Island, Massachusetts, Alaska, District of Columbia, Vermont. I feel like we've seen a few of those names at the top before. It seems like there's a relationship between vaccinations and number of tests. Same thing if you look at the bottom. What's going on here? 100,000 tests. Person at the bottom goes to Washington State, Georgia, South Dakota, Oklahoma, Mississippi, and Puerto Rico. These numbers seem pretty wonky to me, for Puerto Rico in particular, in the sense that it has the highest reported vaccination rate, but the lowest number of tests per 100,000. And earlier we made mention that maybe we don't want to include it. I'm deciding not to include it in our analysis. And so I'm going to do this thing where I am excluding it from all analyses with this data source. Real quick, coming back into the chat, making sure everything's good here. All right, great. Next thing, test per 100,000, case rate per 100,000. Got the most cases per 100,000, North Dakota, Tennessee, South Carolina, South Dakota. Makes sense. Fewest cases per 100,000, District of Columbia, Oregon, Maine, Hawaii, and Vermont. And then finally, death rate. Lowest death rate, Vermont, Hawaii, Alaska, and Maine. Makes a good amount of sense to me, especially with Hawaii being both remote and very rigid about who they let into the state, since they're an island, whereas people have had a pretty easy time kind of flying and driving within the mainland. And then there is Mississippi, New Jersey, Alabama, Louisiana, and Arizona. And there are a number of factors that play into this, including, the availability of hospital beds, the quality of care, etc. in the state. I imagine also how dispersed the states are, like whether or not it's easy to get to a hospital or not. Actually, the fact that there's a very low death rate, and we're looking at Alaska, may or may not be consistent with that statement. They're a big state, but the majority of their populations are in both Juneau and Anchorage. All right, cool. So I'm going to call this one bar plots. Then here's the next thing. Let's start looking at the relationship between things. So what I care about, just to make some things simple, I'm going to hide everything that I don't care about. Well, community transition, that's interesting. Just for now, I'm going to hide these. Total percent positive. Okay. Hide these. All right, so here's the next thing that I'm interested in. What is the relationship between these variables and each other? So actually what I'm going to do is, this is nifty. So this is tests per all of these percent fully vaccinated measure values against measure values. Names. And I'm going to compare all of these values against each other. So this is number of tests, case rate, deaths. And we're going to turn this into a scatter plot where you can compare every variable against every other variable. And we're going to do this by state. And one more thing has to happen. Right now, you can see at the top, this is defined as a sum, so it's adding all of the numbers up together without separating them. Whoops, actually I'm going to do here, move that over here. It's in the wrong area, so I need to put state and territory into this thing called detail. Detail tells this tool, Tableau, what level of granularity you want to look at the data by. Now you can see it's by all of this, right? Great. Slide this chart over a little bit so we have a little more graph space. Make this a little wider and also a little taller, so we'll be able to explore it, scroll into it. And then there's one last thing that I'm going to do here, which is I'm going to convert all of these, just to be sure, into their actual raw values instead of what's called a calculated field, which is the sum. So to do that, you select all of the values, right click, turn into a dimension. And the same thing over here, all of these, right click and then turn into a dimension. Okay, next question is what do you see? So let's focus on just one row at a time, and I'm going to percent fully vaccinated at the very beginning of all this, because what I'm curious about is how do vaccination rates relate to everything else? So percent fully vaccinated versus deaths per 100,000 seems completely uncorrelated. Percent fully vaccinated versus cases per 100,000. It seems like the higher the number of, the more vaccinations, the fewer cases. Seems like a strong relationship here. Here, sorry, maybe slight negatively correlated relationship. More vaccinations, fewer deaths. Go up. What is the relationship between vaccinations and tests? It looks like there's a strong positive correlation. I'm going to pause for a moment and go back to the chat. Are there any questions or things that are interesting that you want to get into? Do you? Let me know. Cool. So the last thing that I'm really interested in is, these all seem pretty normally distributed. There's no kind of like special cleaning that you need to do to get into this analysis. So I'm going to do something real quick, which is do a trend line. Is it 100% accurate? No, it gives you a general sense of how these different variables are related to each other. All right, so here you can see if you hover over the trend line that it both gives you a p-value. A p-value is the statistical likelihood that this line, this trend line, describes the relationship between vaccination rates and death rates. And here it seems like there's an R-squared of 0.119118. There's a technical definition for that I will not go into right now. And essentially what this says is for every percent increase in vaccinations, for a state, that the death rate per 100,000 people will go down by 288. Now if you look up, true for vaccinations and cases, or COVID cases, yes, very low p-value meaning it's very significant. R-squared very high meaning there's a very strong relationship between the percent of people who are fully vaccinated in the state and the number of cases per 100,000. This is actually for every 1% increase in vaccination rate, every 1% of the population that's vaccinated in the state, as that increases, the number of cases per 100,000 people in that state goes down by 27,000, or has over the entire year since before COVID. Now, this is even before we had a vaccine. And then looking at the same thing, one more up, vaccinations and tests, there's kind of no surprise there. There's very strong relationship between the number of vaccinations and the number of tests being administered. There are a number of reasons for why that could be true. Including just access to better medical care, higher level of resources in one state versus another. Who knows? One last thing that's really interesting. So cases and deaths, are the two related? You would think so, right? Because you can't die unless you do have COVID. So again, very low p-value, very significant, or decently high R-squared. And so in this case, what it's saying is for every case per 100,000 people, for every one case per 100,000 people increase, that there is a 0.013 increase in deaths per 100,000 people. So for I think I'm doing my math right here. For every additional 100 cases, one more person dies. Is the relationship. So one more thing that's kind of interesting to me is that, what I'm looking at are the people who are fully vaccinated, and this means that we're only looking at the data set that vaccinations only started in March of 2021. But here we're kind of comparing cases per 100,000 for a year and a half going back. So we're comparing two different time periods. I have a question about whether or not this effect is more pronounced if show hidden fields. If this is more pronounced if we actually look at the last 30 days versus total vaccination rate. So I'm going to do this. This is vaccination x whole period. And duplicate and do vaccination not by a whole period, but x last 30 days. We still have a period mismatch, but at the very least, what we do know is for the entire period of the last 30 days that vaccines were available. And so what I'm going to do is I'm going to replace test per 100,000, case rate per 100,000, death rate per 100,000 with tests per 100,000 in the last 30 days. Why? So I'm going to unhide it. Test per 100K in the last 30 days. Change that over here. We have to turn these both into dimensions again. This is dimensions. Cases. 100. Filter by cases. Oh boy, they're really all over the place with this. And 7-day case rate. Cases per 1,000. Case in the last 7 days. Confirm cases. Alright, we're going to 7 days. 7-day cases rate per 100,000. Case rate per 100,000. So, unhide. Dimension, replace this over here. Same thing with this. We're going to be looking at 7-day case rate. We should also be looking at 7-day test rate. So total God. Tests. No, test for 100,000, last 7 days. On high. I'm going to replace this to a dimension. Replace this with the same thing. This will also be a dimension. And then deaths. Deaths in the last 7 days. Seven-day death rate per 100K. All right, great. There we go. By the way, whoever works at the CDC really needs to work on their naming conventions. This is inconsistent, which, if you know me, bothers me to no end. But also, generally speaking, when dealing with data, you kind of want things to be named the same thing, so it's easy for you to find them. All right. So, what are we seeing? There still seem to be some pretty strong relationships. So what are they? So what we're seeing is that there's a very strong relationship, a much stronger relationship between vaccination rates, the percent of the state that's fully vaccinated, and 7-day death rate per 100,000. It makes sense that I'm going to go back to the other screen really quickly just so you can compare. That here, the p-value, the statistical significance of the trend line was lower, but also the r-squared, the strength of the relationship, was weaker. But if you look at this line over here, so this is the 7-day death rate per 100,000% fully vaccinated, has a much lower p-value, meaning it's more statistically significant, and the r-squared, or the relationship between the two, are much stronger, and that makes sense because over the last 7 days, both vaccines have been available and people have been dying from COVID. And then the 7-day case rate versus the percent fully vaccinated, still a negative relationship. And then the percent vaccinated versus number of tests, same relationship. More states with more vaccinations have more tests. While we're at it, why don't we look at the other one? So the way to look at this table is you can look at, this graph right here is where it's percent fully vaccinated versus percent fully vaccinated. So it's always going to be y equals x, or a perfectly diagonal line. And same with this one, which is test per day, or test per day, and then case rate, and so on. So the graphs that we care about are in the bottom left corner here, because if you look, you could also look at it at the top right. But the top right graphs are just the bottom left graphs with the x and y axes flipped. So it's usually easiest to just look at one set of graphs or the other. I'm choosing to look at the bottom left set. So then here's another interesting set of relationships. What's going on with the number of tests over the last 7 days in case rate? Almost no relationship. They're like flat. What about tests versus death rate? States where they're more testing, there's a lower death rate. Again, possibly medical availability. It could be something else. And then finally, there is the case rate versus the death rate. Yeah, right. You get sick more with COVID, you die more. Cool. One more nifty thing that you can do here. So there are some variables where they're just some like breakaway numbers. So for example, the number of tests per 100,000 in the last 7 days has some outliers. So I'm asking myself, if I log this, will the relationship become any clearer? So I'm going to take the uh, the going to log scale um, each of the all right features and text to make sure it's not one of you all trying to send me a message. Log this and yeah, log everything that in those quadrants. And oh, I think this tells the story even more clearly. Just looking at the dots. Yes. So, this is this kind of makes a lot of sense to me, right? And I don't think it's surprising to any of you that are looking at this, but how kind of like pronounced and clear it is that there is a negative relationship, meaning more vaccinations mean less deaths over the last 7 days, and more vaccinations mean less deaths, even over the entire time that COVID that we've been experiencing COVID in the United States. That the higher vaccination rates are, the fewer cases of COVID there are, which is true both for the entire period and the last 7 days against highly statistically significant. That if there are more cases, there are more cases, there are more deaths. There are more cases, there are more deaths. There are more vaccinations. There are fewer cases, there are fewer deaths. Unsurprising. And pretty cool. And then, unsurprisingly, again, vaccinations tend to correlate well with testing. And testing isn't entirely correlated with the number of cases that people get, but vaccinations, very strong relationship between deaths and cases. Cases means deaths. So, get your vaccine. That's what I took away from this. Little background on me. I decided to get the J&J earlier this year because I was lazy and it was right next to me, so I just did. And I'm probably going to go for a Moderna booster because all of the studies have kind of shown that both Pfizer and Moderna are extremely effective within a 90-day window of after you get the shot. I believe the rate of the efficacy of the Pfizer shot within 90 days is 91%. Moderna is 93%. But where things really make a difference between the two is in the long-term protection that you get from the Moderna shot, which is that the Pfizer shot has something like 40 to 50% efficacy after 120 days. Wait, let me see if I'm getting my numbers right. 120 or 180 days, so usually 6 months. Whereas the Moderna shot has something like a 70 to 80% efficacy after half a year. So if you haven't gotten your shot and you're considering it, from everything that I've read, I recommend doing the Moderna. If you have gotten your J&J, people are encouraging getting a booster. If you're getting a booster, consider the Moderna. I'm not a doctor. I'm not an epidemiologist. I'm a data scientist. I would like to be as helpful as possible, but that is what I can share based on what I've read about everything going on in this pandemic. Anyways, thank you so much for joining and for sticking around. Really sorry for the echo earlier. We'll do this a few more times. We'll look at other data sources. We'll have more fun doing it. But I appreciate y'all's being here. And if you have any questions, reach out to me on Twitch. You know what my handle is. It's Charlie 5000, like Charles, but with 5,000. And have a great day and stay safe. Thank you.